everyone. I'm Natalie Kunzman, MD, and today we are going to talk about women's health prevention. And as the new year is approaching, this might be a good time to get out your checklist, especially to figure out which things you need to do to make sure you are well for the upcoming year. Okay, so I often remind people that the health preventive tactics that we recommend are born from the number one causes of death. So when I get my very young women in the office in their early 20s, there's not a whole lot of things that we need to do because the number one cause of death in our 20s is motor vehicle accidents and not so many medical related problems. So the preventive tactics will change as we get older throughout the years. In the very beginning part of a woman's life, we start recommending pap smears. And what is a pap smear? Well, it stands for Papa Nicolau. And it is the evaluation of the cervical cells, because the cervical cells, if exposed to a few strains of HPV, can become abnormal, or if it progresses, can develop cervical cancer. The age 21 is when we start doing these pap smears, whether a woman is sexually active or not. The reason that we do this, obviously, is if there are cellular changes early on, we can take care of that problem before it moves on to become cervical cancer. So that's the first preventive tactic that we will talk about in a woman's life. The next ones that we start considering once you start hitting in your 30s and your 40s might be a round of blood work. Now, in that blood work, the things that I am particularly interested in is thyroid health, which can change all throughout the years. I'd like to see what the sugars look like, and sometimes I will look at the sugar in relationship to the insulin, and that is to help determine whether or not we are frankly diabetic, or if we have some pre-diabetic pictures or sugar dysregulation or metabolic dysfunction becoming unearthed. Of course, same reason with prevention. The more we learn at a younger age, the more we can modify and change some health habits such that we can make some changes. I'm also very interested in a cholesterol profile, but as many of you know, my take on cholesterol, it is not necessarily, frankly, for the cholesterol itself, but for the triglycerides, for the ratios of the lipid particles. And I start screening now for lipoprotein A, ApoB, and some of those lipoprotein particles or moieties that can attach to the cholesterol that make you at higher thrombotic risk or higher rate for artery clogging, atherosclerosis. And we can learn that profile fairly early on in our 30s and 40s, again, to help modify lifestyle, because that lifestyle is extremely important to change our overall health and wellness. We are not just our genetic blueprint. Some of the other foundational pieces that I like to screen for prevention is our hormone status. Our hormones are obviously optimal in our 20s and 30s, but as we start noticing changes and potentially decline, this is where we will start seeing the cholesterol, which is needed to make that hormone base. This is where we will see that cholesterol start making some changes. And as you see the whole picture of the hormones and the biochemistry, we can start identifying those pieces that need to get fixed. Vitamin D is also in there. Cholesterol is needed to make vitamin D. So I'm very interested in seeing what vitamin D is doing, because that helps our immune system, it helps our bony health, it helps quiet down inflammation. So those pieces are important. Okay, so that is some of the blood work that is requested. Now, as we start moving on into our 40s and our 50s, this is where mammography and breast imaging comes in. I will give a sidebar comment that thermography, which is measuring a heat-associated cellular changes in the body, can actually be a precursor or adjunctive with mammography. Now, obviously, you women that have a family history of breast cancers, you may start imaging a little bit sooner than the woman who is at low risk or average risk. Clearly, breast cancer has now become what I would describe as a chronic illness and not a death sentence. So it is important to consider some breast imaging, and depending upon if the breasts are dense or if pictures are unclear, we may actually need ultrasound to go with mammography, and even potentially MRI to get a closer look at the breast. So obviously, mammography, breast imaging is important throughout the years. Also important for us women is bone density scanning. One of the number one risks for an elderly woman's decline and death is actually hip fractures. We can learn very early on, and screening would be usually in the 50s, for sure in the 60s, and we start putting our risks together to determine when you should have a bone density scan. So smoking is at risk, small stature is at risk, hypothyroidism is a risk, vitamin D deficiency is a risk, previous fractures are a risk. And at this point, again, if we can assess the underlying bone density, and if it is below standard, we can actually modify our bony health by optimizing vitamin D, working out with some resistance training, optimizing our hormone base. And there's a lot to do to increase our bone mass that is within our power. Of course, there are some bone building medications that can help if we notice this problem early on. So bone density scanning is quite important for us women. Now, some other preventive tactics will revolve around some immunizations. And this discussion is not really a debate on if immunization is right for you. However, there are some immunizations that may be recommended once you hit your 60s, which would include potentially a flu shot, a pneumonia shot, which is protecting from strep pneumoniae. There are the shingles vaccinations that are available for shingles prevention in the future. We always have our underlying tetanus that we sometimes forget, but tetanus lives in the spores, and if you are an outdoorsy type of woman, we certainly need to make sure that tetanus is optimized. Of course, we might be talking about coronavirus and COVID vaccination, but again, that is a discussion for another day. So once we hit 50, us women should also start considering colonoscopy. Now, if you are higher risk with a family history, you may opt to do a colonoscopy a little bit earlier. Now, again, what I'm talking about are screening tests, and if there is some rectal bleeding and there is some abdominal complaints, we pull the trigger much sooner, and then it's no longer a screening test anyway, it's a diagnostic test. But when we hit 50, a colonoscopy is quite important, and I dare say that a colonoscopy gives us a lot more value than a Cologuard. So a Cologuard, to me, is something you may want to do after you've at least had a colonoscopy. Why do we do a colonoscopy at 50? Why do we do it at all? Well, colon polyp, the lifespan of a colon polyp, when it is benign and starting to grow, to the time it takes to become cancer is 10 years. That's why if you get a screening colonoscopy that is normal, you get to wait 10 years until your next one. Again, colon cancer is starting to get up there with breast cancer as far as #1 cancers to be recognized. Now, also in that vein, when it comes to screening, a lot of women who smoke, who've had a lot of sun exposure, or just a good practice in general, would be to get to the dermatologist. And this is screening for melanoma, basal cell, squamous cell, skin cancers, and that also is a good technique. Throughout the years, we may want to do our blood work on a yearly basis, our skin exams on a yearly basis, a routine health exam to help identify any problems before they become big problems. And then as we hit our 50s and our 60s and our 70s, this is where some of the screening tactics that I just described make a lot more sense, because our cellular health is aging and the likelihood of some of these conditions will significantly increase by multiple fold. Again, if you have symptoms, you should target them, and then we are no longer talking about screening tests. This gives you a thumbnail sketch. Please make sure in the new year that you are targeting your health in an aggressive preventive fashion, because it will pay off in the end. Again, I'm Natalie Kunzman, MD. Subscribe to my channel below. And until we meet again, be well.